Fracture of the coccyx. Let's discuss in detail. Coccyx or a tailbone is a small triangular bone at the base of the spine. As you can see here, this is the posterior view. This is the lateral one. As you can see here, this red portion is the coccyx or the tailbone. This bone is said to be fractured if there is a break in the bone, or sometimes it might displace. Now this often occurs when an individual falls, particularly on the buttocks, as you can see here in the image, in the sitting position. So any fall in the sitting position where the buttocks are hitting the ground can cause this fracture. Now this is another example. So in young individual, this is usually seen due to high impact trauma, but in elderly, these fractures occur due to osteoporosis or any other condition that causes the bone weakening. Now, due to the nature of the coccyx structure, as it is located between the buttocks and it is slightly bent inside, so this fracture often not immediately diagnosed. Clinical features. So first is patient will give the history of trauma. So first clinical feature is pain. This is the primary symptom in the area of the tailbone. So in the whole tailbone area, patient will complain that there is pain. Pain is usually considerable in most of the cases. Patients say that the pain is there while they sit. So pain is often exaggerated when sitting, as you can see here in the image, especially when the patient leans back. So what happens when the patient leans back? The pressure of the upper part of the body falls in this region, which compresses the tailbone and hence will result in the pain. Second is, patients say when they rise from the seated position, then also when they try to raise their body up, there is a pressure that comes on the tailbone area. So both these conditions will cause pain in the affected area. Now pain can also be felt during bowel movements as there are forces that acts around this area. Pain may persist for several months because sometimes this fracture is not diagnosed on the immediate basis. Comfortable positions for patients are standing and lying. Examination. So the doctor will always assess the area for tenderness, swelling and bruising. Tenderness. Usually the area around the coccyx is tender to touch. Swelling and bruising. There may be visible swelling and bruising around the tailbone if there is a high impact trauma. Deformity. Deformity at the region of the sacrococcygeal junction. So obvious deformity will be there when we palpate the area. Diagnosis. X-ray is usually done to confirm the fracture or displacement. In some cases, MRI may be needed. If the fracture is very minute and it is difficult to diagnose the fracture on the X-ray, or if there is a major injury that affects the neighboring soft tissue structures, in such cases MRI is recommended. Treatment. No specific treatment is usually needed except to minimize pain. So first and foremost is rest and icing. We'll ask the patient to do rest and do the icing, ice therapy that will reduce the swelling as well as pain. Now, protect the bone from further injury. For this, cushioning is recommended. Usually, donut pillow or the cushions while sitting are recommended to the patient. This provide comfort and support. So that avoid the pressure over this area and will eventually leads to relief in the symptom of the patient. Another method that can be used to avoid pressure on the tailbone is the use of towels or sheets to avoid pressure directly on the bone. As you can see here in the image, by placing the towels or the sheets, one can create a space in the region below the coccyx so that it will rest. Medication. Pain relievers may be used to manage pain. Manipulation. Now, manipulation of the sacrococcygeal joint is done under anesthesia. Patient is given general anesthesia to ensure complete relaxation of the area. The coccyx is then manually manipulated by placing a gloved finger into the rectum. The bone is then adjusted to its normal position, as you can see here. Recovery. Many people usually recover and return to the normal activities within few weeks. But full recovery takes time, and sometimes it might take 8 to 12 weeks, which is 2 to 3 months. Now, the reason for the slow repair of this injury is the malunion or the non-union, which is due to the pull of the anococcygeal or the levator ani muscles. They sometimes pull the fracture fragments towards their direction, and that will result into the malunion or the non-union. Surgical management. So first, the surgical management, coccygectomy. Coccygectomy is the procedure. It is generally reserved for those patients which complain chronic pain which doesn't respond to the conservative treatment. So in this, excision of the coccyx is done. Once it is done, symptoms of the patients are relieved. Care must be taken during this procedure to make the stump of the sacrum rounded, as this will lead to the satisfactory results. Otherwise, the end of the sacrum might cause problem to the patient when they sit.